Now let's talk about the sinew channel of the lung, or the lung sinew channel. The pathway. The lung sinew channel begins on the thumb at lung 11, at the radial aspect of the corner of the nail. Then it spreads along the radial aspect of the thumb and the first metacarpal bone, as well as the thenar eminence. It meets lung 9 and binds at the radial wrist joint space. Travels proximally along the anterolateral aspect of the forearm and reaches the elbow at lung 5 and binds at the biceps tendon. It follows the biceps brachii muscle and the lateral portion of the deltoid muscle. Binds at the anterior shoulder region near the acromioclavicular joint, then continues to the axilla and meets the other hand yin sinew channels, the pericardium and the heart, at gallbladder 22, and binds there. Then it continues deep to the pectoralis major muscle and enters the supraclavicular fossa at stomach 12. Courses to LI15 and returns to stomach 12. Then it penetrates the supraclavicular fossa and disperses into thoracic and hypochondriac region and the diaphragm. Clinical importance of studying the lung sinew channel. Pathology: stiffness, cramps, and pain along the sinew channel. Chiffon: spasms and pain in the thorax and hypochondriac region. In severe cases, formation of nodules below the right lateral costal region and distension along the lateral costal region. Indication mainly for P syndromes, or the painful obstruction syndrome along the lung channel. So we mainly use the sinew channel of the lung for P syndromes. The area covered by the lung sinew channel is larger than that covered by the lung primary channel. This explains why the indications of points on the lung primary channel include disorders and diseases of the thoracic and hypochondriac region. So here is a simplified illustration of the lung sinew channel. To summarize, the lung sinew channel originates on the thumb at lung 11, and then it emerges in the region of stomach 12, then travels laterally to the shoulder, anterior to LI15, then returns to the stomach 12 region and descends into the chest, spreads over the diaphragm, and converges in the region of the floating ribs. So this is a summary of what we have taken up. The lung sinew channel originates on the thumb at lung 11 and ascends to bind at the thenar eminence. Then it follows the radial pulse and ascends the flexor aspect of the forearm to bind at the center of the elbow. So that's supposed to be where the lung 5 is. Then it continues along the anterolateral aspect of the upper arm to enter the chest below the axilla. Then it emerges in the region of stomach 12 and then travels laterally to the shoulder anterior to LI15. Then it returns to stomach 12 region and descends into the chest, spreads over the diaphragm, and converges in the region of the floating ribs. Pathological symptoms of the lung sinew channel, cramping and pain. So this is usually the site or the location of every time the patient complains of cramping and pain. When severe, there will be accumulation of lumps below the right lateral costal region, tension along the lateral costal region, and spitting of blood.